Hey, this is Kendrick at worldmedicalschool.org. We're going to talk about antidepressants. So we've used a lot of different substances to treat depression over time. Tricyclics are kind of the classic one. And I use the mnemonic Andy. Think of a little boy named Andy on a tricycle. And so the A stands for amitriptyline, the N for nortriptyline, the D for desipramine, and the I for imipramine. And then we move on to the SSRIs and the SNRIs. So this one takes a little bit of imagination, but I think of the SS as standing for so sexy, and the SN as standing for so not. So the so sexy category, those are the ones with the freaking fabulous pecs. So for our FF pecs, we're going to think of fluoxetine, fluvoxamine, and paroxetine, citalopram, citalopram, and sertraline. For the so not sexy, those are the people who sit around and watch DVDs. So you think of desvenlafaxine, venlafaxine, and duloxetine. Should have added milnacipran in there somewhere, but I forgot them. So think about, let's see, DVD M. No, I can't work that in on the fly. Over to the MAOI inhibitors, or the MAOIs, I mean. I think of PDs. So this one takes some imagination too, but think of some parrots all named PD in Maui. And that gives us our PTS. The P stands for phenelzine, the T for tranylcypromine, and the S for selegiline. And then we move on to the atypicals, and I think it would be very atypical to have a TV channel called BMTV, or bowel movement television. So B standing for bupropion, bupropion. I always add an extra R in there. And the M for mirtazapine, the T for trazodone, and the V for venlafaxine. And then the mood stabilizers, I don't have a mnemonic for this. LVC, let's see, that's going to stand for lithium, valproate, and carbamazepine. I think we could probably add lamotrigine in there too. But we're actually really only going to talk about 4 of these categories here today. We're going to talk about tricyclics, SSRIs, the MAOIs, and the atypicals. And so the TCAs, remember that's Andy, amitriptyline, nortriptyline, desipramine, and imipramine. These are going to be used for depression and anxiety. Pretty much all these are going to be used for depression, anxiety, except maybe, I don't know if you use the atypicals really for anxiety, but depression for all these categories, and anxiety basically for all of them too. You also use these for chronic pain and for migraines. And then amitriptyline has been used for enuresis. So people who wet the bed can use amitriptyline. Let me make sure that that's what the right amitriptyline. No, imipramine. Sorry. So imipramine for wetting the bed for the enuresis. For the side effects for tricyclics, I think of tri-Cs, the 3 Cs of TCAs. Cardiac arrhythmias. This is the scary one because it can kill people if they OD on it. The C in cholinergic, anticholinergic, and constipation, which actually goes in under the anticholinergic, but I need another C. So anticholinergic, we remember those. Those are the where everything kind of dries up. You have constipation, lack of urination as well, lack of tearing, and sedation are some of the big categories in anticholinergic. And this one, just remember, we don't really give these to many people anymore for depression just because of the suicide risk. So remember, people can kill themselves with TCAs, with not all that much of them either. I think it's like 2 weeks supply will kill somebody. So then we move on to the SSRIs. These are what did we say? Freaking fabulous pecs. So fluoxetine, fluvoxamine, paroxetine, escitalopram, citalopram, and sertraline. I don't know if you say escitalopram. I always say escitalopram and citalopram. I don't know which one is right. And then sertraline. So we use these basically just for depression and anxiety. That's not true though. There's we use them for some other things as well. But depression and anxiety are the main categories. We don't really use it for pain like we do some of the others here. And the main side effects that you'll be tested on are Serotonin Syndrome. So you're going to have somebody show up at the emergency room with fever, myoclonus, they've got mental status changes, and they may be having some cardiovascular issues. And a lot of times in the scenario, you're going to have an SSRI on board, but also maybe an MAOI, which nobody really does. But if it were to happen, you could end up with serotonin syndrome. There's also some worry about this with St. John's wort, because St. John's wort kind of acts like an SSRI and can increase serotonin levels. You also have to worry about pulmonary hypertension with paroxetine. I'm going to back up for a second. I should have just discussed this at the beginning. So the main ways that we decide what to give for depression is based on side effects, because most of these are just as effective as others. There are some special cases that we'll talk about, especially with the atypicals, but in general, we're just going to kind of avoid the side effects that would be most detrimental to the patient. So going back here, we're going to move on to the atypicals, which this is especially true for. So atypicals we use for depression and anxiety, and sometimes for chronic pain as well. Bupropion is a good one. This is the Wellbutrin. You don't want to give this for somebody who has seizures, but you do want to give it for somebody who's super worried about sexual side effects. So a lot of times young couples are really worried about this, or just swingers in general don't want to have sexual side effects. So you'll avoid the bupropion in those cases. Mirtazapine for people who are losing weight, you want to give them mirtazapine maybe. Or for people who aren't sleeping well and aren't eating enough, then you might give them mirtazapine, and then you'll avoid it in the really, really overweight people. Trazodone. Priapism is fairly rare here, but it kind of scares people. So there's not really a certain category of people that you avoid priapism in, but some people might opt out of taking it just because they're worried about that specific side effect. But a lot of times we'll prescribe trazodone just for sleeping. And so somebody's having a sleeping problem on top of their depression, this is a good one to go for. Venlafaxine, just remember diastolic hypertension. If you can remember it. I've never remembered that, but hopefully I will after this video. So the MAOIs, this is another pretty rare one for you to prescribe, because the side effects are just can be pretty bad. And but remember this, especially for testing purposes. Remember, it's phenelzine, tranylcypromine, and sledgeline. And these are especially helpful in atypical depression. Remember, we talked about in the depression video that atypical depression is the depression that's associated with, instead of insomnia, with hypersomnia, and with instead of a loss of appetite, with they're associated with an increased appetite. And also, atypical depression is often associated with physical symptoms. So those might warrant MAOIs. If you're going to be doing primary care, I'd send it on to somebody else. I'm not going to be prescribing MAOIs, I don't think. So the side effects, we mentioned already serotonin syndrome. If you're taking MAOIs with a serotonin reuptake inhibitor. But the big one that you'll see on tests specifically is the hypertensive crisis. And this is classically the person who presents with hypertension and a headache after eating cheese and wine. Those are your big sources of tyramine. So you'll think of a fine dining experience, and hypertension leads you to think about MAOIs as if people all the time are coming in not knowing what medications they take. So which one of these was the one that we avoid in epileptics? That is correct. It is bupropion. Bupropion. Sorry, I keep adding that R in there. Causes fever, myoclonus, mental status changes. This sounds a lot like serotonin syndrome, so you think of your SSRIs or your SNRIs. Use this one in old ladies who aren't eating. Think about mirtazapine for this one. Causes constipation, dry mouth, urinary retention. Those sound like anticholinergic side effects. So TCAs, remember the C for anticholinergic. Can cause hypertensive crisis. We just talked about that one. That's the MAOIs. Causes diastolic hypertension. Oh man, did I really already forget this? I just said it. This is paroxetine. Causes pulmonary hypertension. Used for people who don't sleep well. So this could be a couple of them. Mirtazapine, remember we said was sedating, but trazodone is probably the classical one that we'll use for people who aren't sleeping well. Used for chronic pain. You could include TCAs in this category, or some of the atypicals as well. Used for people who don't want sexual side effects. The bupropion is the one we don't have as many sexual side effects with. Contraindicated in eating disorders. So why would we not want to use one of these in eating disorders? Well, because eating disorders can also be associated with seizures. So again, we're going to do bupropion is not indicated in eating disorders. Which one would be indicated in eating disorders? Mirtazapine would be a good one, just because it helps people to have more of an appetite. Don't give this one to suicidal patients. TCAs, they can kill themselves with it. And this one is often used for migraines. TCAs again, like amitriptyline. All right, thank you for watching the video. If you want to volunteer, you can visit us at worldmedicalschool.org/volunteer. There's lots to do. You can help by helping prepare these presentations, gathering information, editing, helping to design the website, and there's a lot of other things to do. So come visit us at worldmedicalschool.org, or at least leave a comment below and let us know if there's anything that was incorrect in this video, anything that we could do better, or anything that's outdated, or anything that just should have been included and wasn't. Thank you.